care that everybody can afford. Every community should create their own self-insurance where they can, you go to the doctor, pay a $50 copay, they send the county a bill for the rest of it. They give 4 million people, 50,000 people going to the doctor. That's a lot of people paying a premium into a savings account that they're only paying for what services are provided, and they're not putting big bucks into these administrators' pockets. Like Kaiser's making tons of money, and they're abandoning Hayward, moving to San Leandro. The other solution for St. Rose, they should start selling their own insurance plans. I lived in Billings, Montana for 3 years. St. Rose Hospital, Deaconess Hospital, you could buy your own medical plan that you could afford right through the hospital directly. Thank you.
Thank you. Ms. Hayashi?
Thank you. When I was in the legislature, the first 3 years, Senator Kuehl and then Senator Leno authored the universal health care legislation, and I was a very proud co-author, although the bill was vetoed by the previous governor several times. In the absence of that, I believe that the affordable health care, the federal health care, also known as the Obama health care, will be an important tool for many of us here in Alameda County. About 17% of Alameda County residences do not have health insurance coverage right now. And we suspect that by 2018, and that's when we believe that the federal health care reform will be fully implemented here in California, we expect that 95% of Alameda County residents will be covered. And this is an exciting endeavor, and I think that there will be opportunities for us to get federal and state subsidies. There's several important provisions in the bill that I want to point out. The federal health care reform says insurance companies cannot discriminate you, even if you have pre-existing medical condition. And you know, that's an important insurance reform that is being implemented through the federal health care reform, because in the past, as many of you know, they would discriminate members based on pre-existing medical condition. Another important reform to mention is individual mandate. Everybody has to get coverage, and if you don't meet the standard, there's a federal subsidy to pay for that.
Thank you.
Thank you.
Thank you. All right, for this next question, we'll let Mr. Green go first. Do you expect impacts from the cuts in child care and health delivery, and what can supervisors do to provide services to people who have lost their social safety net?
Well, the biggest thing that we could do for people who have lost their social safety net would be to find a job for them, have those people actually becoming employed again, which gets back to what I said earlier. Our greatest need in Alameda County, or anywhere in the Bay Area for that matter, is finding a way to make this as inviting a place for business, for people to establish businesses, and to expand businesses when they're here. Now, bringing that back specifically, though, when that isn't happening, to child care, I know that many of our schools, certainly in Union City, have been looking at expanding child care at both ends of the day, and actually before kindergarten age, preschool, as far as before school and after school. I think there has to be a tremendous collaboration between school districts, cities, and counties for that matter, and the state, in finding ways to have child care being provided on site at schools in every community in Alameda County. That's a facility which is out there. We've paid for it as taxpayers. Our children go there, our grandchildren might be going there. We need to be finding a way to be utilizing the facilities which we have, which are scarce. I mean, we do not have an abundance of public facilities on every block. Where we have them, we have to take complete utilization of those. That could also mean, even for that matter, at cities and county facilities, where I know we've been expanding our own child care and daycare services at county facilities. So we have to take advantage of every possible facility that we have at our disposal.
Thank you. Mr. Turnquist?
I want to see tax breaks for these businesses that provide a daycare facility at their employment. That would get some welfare people off of the couch and into jobs, because the biggest excuse people have is that they can't, it's not that they don't want to work, it's that they can't afford daycare. I'd also like to see local communities making use of their libraries. I mean, when I was a kid, my parents needed a couple hours of daycare. They took me to the library and had story time. But you hardly ever go to these libraries and see any kids after school in the library. But you sure see them running around unsupervised in the parks and on the streets. We need to provide open gym time at these schools for kids after school so their parents don't have to pay for daycare. Just let them hang out at the gym for a couple hours and then pick them up, take them home. There's a lot of solutions out there that can provide a lot of free time for volunteers that want to get involved helping the kids. I've spent thousands of hours myself, and I plan on continuing to do it. If any of you out there want to volunteer and help the kids, get a hold of me. I'll set you up with the program. Thank you.
Thank you. Ms. Hayashi?
Thank you. Well, people can't go to work if they don't have childcare. And for many single moms throughout the state, and especially in Alameda County, we need to make sure that childcare services are fully funded and it's available to those who need it. And of course, county has a workforce investment board that provides a lot of job training. And earlier this year, my office hosted a job fair at Chabot Community College. And with very little advance notice, we attracted over 1,200 participants at the job fair. There's an incredible need out there for people to not only seeking employment, to give them opportunity for employment, but opportunity needs to be there for job training. I chair the Community Colleges Select Committee in the Assembly, and we've done hearings up and down the state. And you ask any business, any small, large, Fortune 500 company executives, what is it that you're looking for? What would take you to come to our town and set up business here? You know what they tell us? Number one is education, well-trained workforce. And so economic development, job opportunities, they all link to one thing, education and opportunity. Key to success is having that opportunity for education and having access to education. So as a supervisor, I will work with schools, I'll work with community colleges in the area. We have several great schools here. At Chabot nursing program, there is one of the state's most exceptional programs where everybody wants to go, and those programs need to be accessible to everyone.
Thank you. Mr. Valle?
There's a great group in Union City that actually started in New Haven Unified School District, and it was known as Tri-Cities Children's Center. And the executive director was Paul Miller. That organization has changed, is now called Cadango, and it's one of the largest child care providers, not just in the Tri-Cities, but in Northern California. And it continues to grow because they provide before school and after school care for kids who are going to school. A lot of our kids in high school have children. And the reality is we've got to deal with teen pregnancy, and we have to talk about teen pregnancy and about education, how important it is for these kids who are 16, 17, 18 years old, who have children, who are parents, to change behavior and to look for other ways to communicate with our young people so that these issues do not become an impairment when they're in high school. They'll literally have to worry about getting to the child care center to get their child home, and they lose the opportunity for more education, and they lose the opportunity for finding meaningful work. And those kids that are fortunate enough to find work, we have to provide quality child care. So 4 Cs of Alameda County, which is another great child care support system in our county, and Cadango, those are the community organizations that get a lot of the funding from the county, and those are the support mechanisms, the safety net that the county supports.
Thank you. The next question, we'll start with Mr. Turnquist again. We have several questions here about transportation. So tell us about your transportation vision for the county, and people would like to know your position on Measure B and enabling BART Phase 2 and the east-west connector to be built.
Well, I believe transportation, the key to that to get people out of their cars, because this is a huge society. People are afraid to leave their cars because of convenience. If you want the public to use public transportation, we need to provide like more shuttle buses. You need to get coalitions of businesses that might sponsor a shuttle bus from BART to the mall, things like that. The cost of taking a taxi is pretty much off the hook for most people. It's an emergency situation. It's a one-time thing. The taxi companies are hurting. The AC Transit ridership is down because the services have been cut. The prices need to come down so people can afford it. We need to get grants for fuel subsidy so that they can afford to run their buses more frequently. And I'm not too sure about this Prop B. What's that about? I'll tell you what I stand on if you tell me what it is.
It's a tax increment for transportation purposes.
Oh, well, I would support that. Why not? Whatever it takes to keep the buses going. I've got a bus license, and, you know, if I have to, I'll get out there and take